Our bodies are constantly communicating with us. They send signals about our health and well-being. Sometimes these signals are obvious, like a cough or a sneeze, but other times they're more subtle. These subtle signals are our vital signs. Vital signs are like a secret language our bodies use. They tell a story about what's happening inside. By understanding this language, we can unlock crucial information about our health. Even small changes in our vital signs can be important. They can alert us to potential problems. Think of your vital signs like the gauges on your car's dashboard. Just like your car's gauges, vital signs help us monitor our body's performance. They can tell us when everything is running smoothly, and they can warn us when something needs attention. 3 vital signs are particularly important: blood pressure, pulse, and temperature. You've probably had these checked at the doctor's office, but do you know what they mean? Blood pressure measures the force of blood against your artery walls. It's written as 2 numbers. The top number is systolic pressure. This is the pressure when your heart beats. The bottom number is diastolic pressure. This is the pressure when your heart rests between beats. Your pulse is the rate at which your heart beats. It's measured in beats per minute. You can feel your pulse at certain points on your body, like your wrist or neck. Temperature tells you how hot or cold your body is. A normal body temperature is around 98.6 degrees Fahrenheit. Changes in temperature can indicate infection or other health issues. Nurses are experts at interpreting vital signs. They are trained to notice subtle changes that others might miss. These changes can be early warning signs of a problem. For instance, a slightly elevated pulse rate might not seem alarming on its own, but to a nurse, it could indicate pain, anxiety, or even dehydration. Similarly, a slight drop in blood pressure could be a sign of internal bleeding or a severe allergic reaction. Nurses use their knowledge and experience to connect the dots. They consider the patient's medical history, current medications, and other symptoms. This holistic approach allows them to paint a complete picture of the patient's health. Dehydration occurs when your body loses more fluid than it takes in. It can be caused by sweating, diarrhea, vomiting, or simply not drinking enough fluids. Vital signs can provide telltale signs of dehydration. As you become dehydrated, your blood volume decreases. This forces your heart to work harder to circulate blood. As a result, your pulse rate increases. You may also notice that your blood pressure drops, especially when standing up quickly. Other signs of dehydration that nurses look for include dry mouth, decreased urine output, and fatigue. In severe cases, dehydration can lead to confusion, seizures, and even death. Infections occur when harmful microorganisms such as bacteria or viruses invade the body. Our immune system fights back, leading to inflammation and a cascade of physiological changes. One of the most recognizable signs of infection is fever. When your body senses an infection, it releases chemicals that increase your body temperature. This helps to kill the invading microorganisms. Along with fever, infections can also cause an increase in pulse rate and respiratory rate. This is because your body is working harder to fight off the infection and deliver oxygen to your tissues. Depending on the type and severity of the infection, other vital sign changes might be present. For example, a severe infection might lead to a drop in blood pressure, especially if it spreads to the bloodstream. Sepsis is a life-threatening condition that occurs when the body's response to an infection spirals out of control. It's a medical emergency that requires immediate treatment. One of the challenges of sepsis is that it can be difficult to diagnose in its early stages. However, vital signs can provide crucial clues. People with sepsis often experience a rapid heart rate, known as tachycardia, and rapid breathing, called tachypnea. Another key indicator of sepsis is a change in body temperature. While fever is common, some people with sepsis may have a below normal body temperature or hypothermia, especially in the later stages. A drop in blood pressure is a particularly ominous sign in sepsis, indicating that the infection is severely affecting the circulatory system. While vital signs provide valuable information, they are just one piece of the puzzle. To accurately interpret vital signs, healthcare providers also consider the patient's individual baseline, medical history, and current medications. For example, a person with a history of high blood pressure might have a normal resting heart rate that's higher than average. Similarly, certain medications can affect vital signs, such as beta blockers, which lower heart rate. That's why it's essential to communicate openly with your healthcare provider about your medical history, any medications you're taking, and any recent changes in your health. Technological advancements have revolutionized the way we monitor vital signs. Today, wearable devices like smartwatches and fitness trackers can track our heart rate, sleep patterns, and and even blood oxygen levels in real time. In hospitals, sophisticated monitoring systems continuously track vital signs, alerting healthcare providers to any significant changes. These advancements allow for early detection and intervention, potentially saving lives. However, it's important to remember that technology should complement, not replace, the expertise of healthcare professionals. Always consult with your doctor or nurse to interpret your vital signs and make informed decisions about your health. Vital signs are much more than just numbers. They are a powerful tool for understanding our bodies and detecting potential health problems early on. By learning to recognize the subtle language of our vital signs, we become more active participants in our own health journey. Remember, knowledge is power. The more we understand about our vital signs, the better equipped we are to advocate for our health and make informed decisions about our well-being.